Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about weight loss after knee replacement surgery. So there's a lot of information and a lot of discussion out there about weight loss and weight management before knee replacement surgery. And the reason for this is if you are overweight and trying to have a knee replacement surgery, there are some increased risks involved. There is an increased rate of just being unsatisfied with your knee replacement, having a more difficult recovery, having the increased risk of just a poor outcome from knee replacement surgery. But I want to talk about already having knee replacement surgery and the importance of weight management and potentially weight loss after knee replacement surgery. And the reason for this is the same processes that caused the arthritis and the knee pain in your body are most likely going on after knee replacement surgery as well. And what I mean by this is when you have increased body weight, there's going to be both physical and biological or systemic things that are occurring that are increasing the risk of pain, stiffness, wear and tear, and breakdown of that knee replacement over time. And so we really need to consider maintaining a healthy weight and losing weight if appropriate. So of course there's the physical stresses. So every pound of body fat that you have or body weight that you have means more weight and forces and stresses through that knee joint in a physical perspective. But there's also the systemic perspective. So adipose tissue or body fat has a lot of messengers and signals that come that are sent off from that body fat, and it can lead to increased inflammation throughout your body. In most of the cases, it does lead to increased inflammation and these pro-inflammatory things that are occurring within your body. So that means increased inflammation throughout the body, but for our purposes, that means increased inflammation in the joints of your body, increased inflammation in the knee joint, which is going to mean increased breakdown. Just like before surgery, leading to breakdown of the cartilage and arthritis, you're still having those processes occurring after knee replacement surgery as well. So that's kind of the why for why it's important to maintain a healthy body weight and to lose weight if needed and if appropriate after surgery. So kind of how do we do this? How do we lose weight and manage weight? So it's just like for any other individual, any other circumstance. What I'd like to really promote and really kind of make you think about today is the importance of nutrition. So of course when it comes to losing body weight and losing weight, there's exercise, there's nutrition. Of course there's other things involved that are just as important, like sleep, getting adequate sleep, and managing stress appropriately and managing your mental and emotional health. But probably the big debate, the big discussion is exercise, nutrition. Which is more important? What should I do? What should I do? And a lot of people probably think that exercise is just as important or even more important, but I really want to emphasize the importance of what you're putting in your body, your diet and your nutrition. Just think about how much energy and how much time it takes to eat one piece of pizza or eat a bunch of junk food and snacks. It really takes just a few minutes to put a bunch of calories into your body. And then think about how much effort it takes to then burn off those calories. Your body is burning calories just through normal metabolism throughout the day. And to get to a point where you're having excessive energy needed and burning off calories through exercise, you really have to put in an increased effort. Think about you have one slice of pizza. To burn off the calories from that slice of pizza, you probably have to go out and walk, I don't know what it actually is, but maybe walk a mile, 2 miles to burn off that piece of pizza. So that means a lot of time, a lot of effort. So what I really want you to think about is we can help kind of balance this equation a lot easier by thinking about and being conscious of what we're putting into our bodies. And there's all sorts of information out there, and I'm not a nutritionist or a dietitian or anything like that, but a couple of things that I definitely would promote is, first of all, trying to emphasize whole plant-based foods, getting lots of fruits and vegetables into your diet. There's so many benefits in terms of nutrition. There's benefits in terms of these foods that are plants and vegetables are high in nutrition, high in a lot of beneficial things, antioxidants, but then very low in calories. A lot of them are very high in water actually. So you're able to eat a lot, but be satiated and be full by having less calories overall. Also, you want to think of foods that are high in fiber. Fiber is a great resource for managing your cholesterol. It's a great way to feel full sooner without having to eat as much food. The calories from fiber, they really don't count. They don't go into your body and become fat. They go through your system, and you don't kind of ingest the energy and calories from fiber-based aspects of food. So things that are high in fiber, you want to try to limit processed foods, limit those foods that are made with all sorts of things, and you read the package and you don't know what it's what half the words mean. Whole plant-based foods, foods that are foods, things that are natural, things that you would grow in a garden, are really the best option in my opinion. And I can dive into all sorts of other things, and I'm not going to do that for this, but I just want to emphasize the importance of diet and nutrition in terms of helping to manage and maintain a healthy weight after knee replacement surgery, just as much so as before knee replacement surgery, and there's a lot of important reasons to do that. I hope you found this information valuable and helpful. Be sure to leave your comments and questions below. Be sure to hit that subscribe button if you're interested in all things related to knee replacement surgery, exercises, recovery, frequently asked questions, and everything else in between. Thank you very much for watching.